When addressing Basotho Nation on current state of COVID-19 pandemic, the Minister of Health Hon Semano Sekatle expressed that vaccination will be enforced from the 1st of January 2022.
Latela bohale ba le fulene le sekgatla sa tshwaetso mmuso o entse qeto hore ho tloha ka la pele Pherekgong selemong se tla thwasa sa 2022 basebetsi bohle ba mmuso ba ditsi le mekgatlo e ikemetseng ba di-company ba ske ba dumellwa ho sebetsa ha ba sa enta. Ya bobedi, tshebetsong tsohle batho ba sa entang ba se fuwe ditshebeletso. Batho bohle ba tla lokela ho fana ka bopaki ba hore ba entile.
In response to what the minister said, Advocate Kabelo Ntitsane mentioned that no one should be forced into taking any form of medication except for cases where pandemic has hit the country, and only the parliament may allow for such law to be passed.
To the effect that from the 1st of January 2022, members of the general public will not be allowed essential services and without their production of COVID passes. First of all, there are 4 important issues that I would like to lay before you for advisory, that you may be aware of your rights under law. First of all, as a matter of law, a medical intervention cannot be made without express consent that is voluntary and informed of a person under consideration. That means you cannot be forced to undertake vaccination without your consent. However, there are permissible limitations under law in which an intervention can be made without your consent. And in this case, it's when a person carries a dangerous infectious disease and endangers other people or members of the public. And in that particular case, a government can intervene. But that also can only be done within the confines of the law. And number 1 is that such an intervention can be made pursuant to a law of general application. That means an act of parliament passed by the Parliament of Lesotho and not by a minister speaking on national television or anyone anywhere else. Number 2, it can only be done in the exercise of emergency powers. First of all, going to the first point is that that particular limitation or law of general application, in this particular case in Lesotho, is the Public Health Order of 1970. The Public Health Order qualifies and sets out the procedure that needs to be followed by the government in order to paternalize or force somebody to undertake a treatment or vaccination in the particular case. It is important to observe, Basotho, that the minister or the government has not followed proper procedure or qualifications under that particular law to do and say what he has done. Number 2 is that limitations can be done through the exercise of emergency powers. Currently, we are under a state of emergency that has been induced by COVID-19. The regulations that are made pursuant to the state of emergency and the Public Health Order and the Disaster Management Act do not empower the minister to say what he has done. In effect, ladies and gentlemen, there is nothing in what the minister said that forces anyone in Lesotho to do anything of vaccination. The net effect of what he has said is a nonentity. It was simply a political statement made to coerce and entertain public opinion. There is nothing in law that forces you to vaccinate, even pursuant to what the minister has said. Thank you.
Currently, Basotho are experiencing hardships crossing into the country.